Flashers and floaters. Introduction.
Can you point to the vitreous gel?
Choose one of the following options.
Correct. This is the vitreous gel, the clear jelly-like fluid that fills the inside of the eye. Can you point to the retina?
Choose one of the following options.
Correct. The retina is the tissue in the back of the eye that transforms light into electric signals that are sent to the brain. If the retina becomes damaged, no signals are sent to the brain, and the person becomes blind. The separation of the vitreous from the retina is due mostly to aging.
Select true or false.
Correct. The fibers of the vitreous gel lose water with age, causing the vitreous to thicken and separate from the retina. This usually starts to happen around age 45, but can occur at any age, depending on other factors. By age 70, about 30% of people have developed a PVD. Flashes are caused when the vitreous pulls on the retina.
Select true or false.
Correct. The retina does not feel pain. When the vitreous pulls on the retina, it excites the retina and produces images. Which of the following is a sign that the vitreous has detached from the retina?
Choose one of the following options.
1. A sudden increase in the number of floaters. 2. Appearance of a veil or curtain that obstructs part or all of your vision. 3. Flashes of light. 4. All of the above. Correct. All flashes are caused by pressure on the retina.
Select true or false.
Correct. Some flashes are images generated in the brain during a migraine attack or other problems that affect the circulation in the part of the brain where vision is processed. Some rare inherited eye diseases can also cause flashes of light. However, the majority of flashes are caused by the vitreous gel pulling on the retina. As the vitreous detaches from the retina, it can create a retinal detachment.
Select true or false.
Correct. A PVD can cause a retinal detachment. This is not common, but when it happens, it is considered an emergency. The symptoms of retinal detachment are similar to the symptoms of posterior vitreous detachment, or PVD.
Select true or false.
Correct. The symptoms of PVD are similar to those of a retinal detachment. A retinal tear is the cause of all floaters that occur after the vitreous separates from the retina.
Select true or false.
Correct. The vitreous may pull on a blood vessel on the surface of the retina and cause floaters to appear without causing a retinal tear.
John noticed several new floaters 2 months ago. He immediately checked with his ophthalmologist, who did not find any retinal tear or other eye problems. Most of his floaters disappeared, but today John notices new floaters and some random flashes. Should he check with his doctor? Select yes or no.
Correct. Even if John has checked with his doctor recently, he should have an eye examination immediately to find out if the new floaters and flashes are caused by a retinal tear or detachment. Linda notices a sudden increase in the number of floaters. However, she does not have any flashes. Should she check with an ophthalmologist?
Select yes or no.
Correct. Not all patients who have retinal tear notice flashes. The sudden increase in the number of floaters could be a symptom of a retinal tear. Linda should check with her doctor.
Thank you for using Explain.